Resiliency Toolkit webinar. This is a distance learning event presented by Kate Glidden and Beth Reynolds-Lewis and hosted by Colorado Community Health Network, or CCHN, and CHAMPS. My name is Valerie Steinmetz. I'm the Program's Outreach and Enrollment Coordinator for the Community Health Association of the Mountain Plains States, also known as CHAMPS. And CHAMPS is your Region 8 Primary Care Association, and I will be moderating today's webinar. So before we get started, I want to touch on a few housekeeping items. Please be aware this webinar is being recorded and all phone lines are muted. If you have any technical issues, please reach out to Liz Tansey and she will help sort those out. And her email is in the chat box. And then I want to just go over some resources available before we get started. On the right of your screen, there's a pod that says Shared Files. And in here, there are 6 resources available to all participants for download at any time. The first one I want to draw your attention to is the webinar note sheet. If you download this, you can take notes as we go through the webinar. And down from there, there's the pro-qual assessment, which will also be referenced today. And then there's other additional resources and a copy of the webinar slides for today's event. And please note that today's event is free for participants from sites that are Health Center Program grantees, federally qualified Health Center lookalikes, and primary care associations in Region 8. All other participants will be billed after the event. And lastly, if you have any questions during the event, please type them into the chat box, which is located on the right of your screen, and we will answer the questions at the end of today's webinar. CHAMPS is a nonprofit membership association of community, migrant, and homeless health centers in Colorado, Montana, North and South Dakota, Utah, and Wyoming, representing Region 8. CHAMPS was founded in 1985 to unite Region 8 health centers in an advocacy and mutual support network of these community-based providers of primary care and related services for underserved communities in the Mountain and Plains states. CHAMPS is dedicated to supporting Region 8 community health centers by providing opportunities for education and training, networking, and workforce development. CHAMPS members receive access to Region 8 specific data, networking opportunities, reports, publications, educational resources, trainings, and much more. For more information about CHAMPS programs and services, including the benefits outlined on this slide, please visit champsonline.org. CCHN represents Colorado's 20 community health centers and their patients. CCHN is dedicated to providing resources to ensure that community health centers are strong organizations and are providing the highest quality care, and is committed to educating policymakers and stakeholders about unique needs of community health centers and their patients. CCHN also funds the Colorado Covering Kids and Families, or CKF project, a statewide coalition-based project with a mission to increase access to affordable health coverage and high-quality health care by ensuring that Health First Colorado, or Colorado's Medicaid program, Child Health Plan Plus, and subsidized private insurance through Colorado's state-based marketplace consistently meet the needs of low-income Coloradans. For more information about CCHN or CKF, please visit cchn.org. Today's webinar, Strengthening Your Compassion Resiliency Toolkit, is the third in a 4-part CHAMPS CCHN 2017 Outreach and Enrollment Distance Learning Series. You can find out more information about the series and access past webinars on the CHAMPS Distance Learning webpage, and I'll put this link in the chat box shortly. All right, so now I would like to introduce our speakers. We have Kay Glidden and Beth Reynolds-Lewis from Compassion Resiliency. Kay and Beth are certified compassion fatigue specialists, earning their certifications from the Green Cross Academy of Traumatology. They have been training human service professionals, healthcare staff, teachers, law enforcement, and first responders on compassion fatigue, trauma-informed care, and behavioral health issues for the last 10 years. They work as a team for compassion fatigue trainings and have trained over 4,000 people in the United States since 2017. Thank you both for joining us today, and I will now turn it over to you.
Thank you. Hi, I'm Beth Reynolds-Lewis, and Kay and I are partners in this training and in our company, and it's such an honor to speak with you all today about compassion resiliency. Briefly, a little bit about my background is in the past years, first of all, I'm a mom of 3 kids. So when we talk about compassion fatigue, it's not only at your work, but it also might be your home life or both. In the past, I have worked as a child protection and safety worker doing child abuse investigations in central Nebraska for around 12 years. After that, I was a forensic interviewer with our local advocacy center here in Kearney for 5 years. And then since that time, have worked in behavioral health, running an emergency system, and have done this training since about 2012. Kay and I were initially trained in Canada by Francois Matou, and we'll share a little bit with you more about her training and some of the things that we have worked with her on. So Kay and I came back from Canada. We were so excited, and we started training some of our workforce locally. Unfortunately, along our path, we had an employee that Kay and I had both supervised at different points in his career. He was a case manager in behavioral health and had decided to go on and get his nurse practitioner. So he was working as a nurse practitioner, psychiatric nurse practitioner in the field, and about 2 years into his career took his own life. It was very tragic for us, and we struggled with the idea of, why when you're surrounded by the helping professionals all day and it is your field choice, it's so hard to reach out and get the help you need. So that has, invigorated us to make sure we're sharing this information with people and encouraging people to take care of their own needs.
Just briefly, my name is Kay Glidden, and my background is I was a therapist at a university for several years, and then have been a supervisor and worked in public behavioral health in Nebraska for almost 20 years. And we just want you to we appreciate you being on the webinar, and we want you to take good care of yourself during this time. Some of the things that we'll talk about might have some emotional trauma, and we just want you to take care of yourself. What we're going to talk about, we don't have very long, but we will talk about what is compassion fatigue, what is the difference between that and vicarious trauma and burnout. You will have a self-assessment that we will talk about. We'll discuss your signs and symptoms. You'll make a commitment, and then hopefully we can give you a lot of tools and ideas to try for daily self-care, because that's really important, daily self-care.
So when we talk about compassion fatigue, it really is the cost of caring for others in emotional pain, whether it be at home, your work, or both.
This is a really good resource that is in your resource guide, your resource sheet, and it is by our trainer in Canada, and it is a workbook. You can go through it at different settings, different times. There's a lot of good tools and resources and assessments in there. And one of our workplace, the people voluntarily decided they wanted to do a book club over this book. So they kept the conversation going and helped each other through giving each other self-care ideas and different resources. So I hope you've had an opportunity to look at the self-assessment that you were given. And there are 3 different categories. There's psychological, behavioral, and physical signs and symptoms. And any of those that you checked off should be a red flag for you. It should be an awareness. And what we're talking about today is not the general type of stress that we all experience, like I'm late to work, I spilled my coffee. It's more in terms of I work with patients and clients who have emotional trauma, not just medical trauma, but also emotional trauma, and they share that with you, or your colleagues share that with you, and you take that on as your own, and sometimes it's difficult to detach. And the reality is, in our system, in our healthcare system, is that you're not to blame, because we're always told, do more with less, be quicker, be more efficient, and we're hearing difficult stories every day. There are times now that you might be more vulnerable to compassion fatigue and vicarious trauma. If you're new to the job, if you're in an office of only one person, if you can relate your trauma, emotional trauma or loss with the clients or patients that you're serving. If you're in a rural area, you might also be experiencing that because we have limited resources, and we also have dual roles. You know, we may see them in the office, and we may see them at church.
So here are 2 great books that kind of help put this connection together. One of them is by Gabor Mate, When the Body Says No. The other one is by Bessel van der Kolk, The Body Keeps the Score. And the reason we have kind of dove into these 2 books or recommend them is because they both help us put that brain and body connection together. So my education was actually to be a secondary science teacher in high school. And I love this part because these 2 books emphasize that idea that emotional trauma does have an impact on the physical workings of our brain. So we used to just kind of laugh and say, well, it's all in your head. Well, it really is all in your head. It changes our brain's functioning. And one of the things that Gabor Mate will talk a little bit about in his book and some of the research he has done is he did a research study for the Women's Heart and Stroke Foundation. It was over 10 years. I think, if I remember correctly, there were over 1,400 women in the study. All the women had gone through a divorce. Part of the women had gone through a divorce and were maybe a little bit more of emotional stuffers, or not dealing with their anger, or maybe not reaching out for help or support through a therapist or a clergy member. The other portion of the group were ones that reached out for help, seemed to be dealing well with anger, maybe reaching out for some formal and informal supports. The group that didn't reach out for the supports was 400 times more likely to suffer from a heart attack or stroke during the study period. So we know there is definitely a connection between how we're dealing with emotional trauma or vicarious trauma and its effects on our physical body.
I think the important thing with that, too, is if we don't say no, our body eventually will say no for us. And I learned that the hard way. My compassion fatigue happened at home. I have 3 boys, and at that time, for about 5 years, they were all teenagers at the same time, and they were all in crisis at the same time. And so I took that on, and it came out through my hips, and I had 2 hip replacements in a period of 3 years. So I tried to ignore it, I tried to deal with it, but it did come out through my body. And so my body was telling me something and I wasn't listening.
So the next clip we'd like to show, we'd like to share with you is by Brené Brown, and it's entitled Empathy versus Sympathy. It's actually from a Teresa Wiseman nursing study. We would like to share this with you, just that idea of what a challenge empathy can be and why empathy and sympathy may be causing a physical toll, an emotional toll on your body.
What is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you can climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's
Valerie,
incredibly painful, and we're trying to silver lining it.
So I
don't think that's a verb,
move on.
but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So the Brené Brown empathy versus sympathy clip just really illustrates that idea of how often we offer somebody a sandwich and how difficult it truly is to be empathetic in your field all the time. Sometimes we struggle. I believe that empathy takes more energy than sympathy, although we all hope to be in that empathetic standpoint.
And sometimes with empathy, really, a lot of times we are helpers and we want to fix everything. We want to give the person the solutions. And sometimes the best thing we can do to be empathetic is just to sit with the person and listen. And oftentimes that's the best thing we can do.
So I want to talk to you a little bit more about understanding compassion fatigue, because it really results in that exhaustion, not only emotionally but physically, that we develop in the course of our careers. I love this quote by Rachel Naomi Raymond. The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting your feet wet. So I think that applies to all of us. What concerns me in my role as a supervisor of behavioral health case managers is if people aren't showing signs of compassion fatigue, I think they aren't getting their feet wet. And you need to get your feet wet to do a good job. So how do we manage or take care of our compassion fatigue? And it really is directly related to our ability to provide self-care to ourselves. You cannot give what you do not have. So it's that gradual erosion that keeps us connected to other people. Sometimes it shows up in a work setting as becoming short-tempered or feeling guilty or angry at the never-ending demands of our job, or sometimes even of our families. So let me give you an example of how it could show up at our work site. I could go in and see Kay and in the morning and say, "Hey, Kay, how's it going?"
It's going great. I just found out I have to go to Hawaii for work. I have to do a training.
You are going to Hawaii for work? That's great. I'm going with you, right?
No, I'm sorry. No, I have to do this one alone.
So you're going to Hawaii without me, and I don't get to go. Who's going to cover for you while you're gone?
That would be you. I'll only be gone like 7 to 10 days.
Must be nice. I wish I could go.
Well, I'll bring you back one of those coconut bra things.
That's lovely. And just for information, I did not get the coconut bra, and she really did go to Hawaii without me. So that's an example of compassion fatigue. It can even show up in your office about paternity or maternity leave. So somebody's waiting for this baby. Maybe it's an adoption. Maybe it's, pregnancy. They're so excited. And yet down the office, maybe not in front of the person, we're talking about, well, do you think they'll come back? Will they be gone 8 weeks, 12 weeks? Who's going to cover their shift? Who's going to cover their information while they're gone? Who's going to take those calls? We've even had it in our office regarding bereavement leave, which is really sad. So maybe Uncle John died and people are concerned, are they traveling all the way out to Tennessee? How long will they be gone? Who's going to cover all of that? So that's just an example of how compassion fatigue may appear in your life. It may be a thought bubble. It may actually be things that you are saying. So when we talk about this, if we had more time together, I would actually go through each of these specifically. And I want you to refer to your guide that we've printed out. Maybe you can decide where you are in the 4 circles. But I want you to remember that your own primary trauma plays a part of this. So none of us grew up in rainbows and kittens. And if you did, please email me later because I want to be a better parent. I want to know how that happened for you. But we all have things that come into our lives. We all suffer from emotional trauma at various times. So compassion fatigue is one part of this. We might also suffer from vicarious trauma, which is just that accumulation of bad stories that maybe change our worldview of how we feel about people. Burnout's just a whole nother beast, and we had more time, we would talk about this. That's really resulting in us, again, having some of those same symptoms, but it can be resolved if we change jobs or change positions. So if I am a nurse for one hospital and I'm feeling burnout, that could be resolved by the idea of I could have the same job duties at a different hospital, but I would feel much better. And moral distress is a whole nother beast. That's when you know the right thing to do, but because of your rules and policies, you can't make it happen. So on your journal or your guide, you might want to take a moment and circle where you are right now within all of these. If you're really right in the middle and you're a lucky guy and you have all 4 of these, that is a cause for concern. And it might be to the point where you really do need some external intervention from a therapist, from your EAP, from other resources around you.
And if you think about the person that's right in the middle there that's suffering from all 4 of these, think about in your office who is the most cynical, sarcastic, dark humor person, and that's probably that person. They're crispy fried. And if we look at that this way, we're looking at them in terms of they really do need some help. They need an intervention. So I know you took the assessment in the beginning of the webinar, and that was the first step. So I want to go through some other signs and symptoms that you might be experiencing. Everybody's journey as far as the signs and symptoms are different. They all look different. So you really need to figure out what are the signs and symptoms for you, and then stop and say, what am I going to do about it? What am I going to do about it every day? What is my body saying to me, and am I listening? So you could have elevated blood sugar, back pain, muscle pains, you're sleeping too much, too little. And if you are swallowing your stress, you're probably seeing things like diverticulitis, colitis, ulcers, acid reflux.
So really, again, that mind-body connection.
So behavioral is what it looks like. So did you used to, when you came home from work, your wine glass looks like this now? Oh. Your wine glass is now a box of wine. You used to have a glass of wine, and now you have a box of wine. So what does it look like for you? Are you not showing up to work? You have problems getting to work? You notice your anger, you're more angry and irritable. You're avoiding certain patients or clients. And the worst part about it is that we're all hired because we are empathetic and we are compassionate. But what the problem is that if it erodes to the point where we begin to have compromised care for patients, that becomes a concern.
And sometimes we see this when people are on their phones, they're doing more work on Facebook instead of actual paying attention to the people they're there to serve.
And then finally, what are your psychological signs and symptoms? Do you notice that you're getting more easily frustrated? You're losing that joy that you had at work, why you got into the field in the first place? And do you have a difficulty separating your personal and professional life? Do you go home and worry about clients and patients? A lot of us do a lot of caregiving at work, and then we go home as parents and we caregive at home. And so we're constantly caring, and we get depleted, and our bucket gets empty. So what can we do to really have a ritual where we can separate personal and professional life?
And I think for a lot of people, this is our calling to our work. And so when we lose that, it becomes very difficult. And this is some of the struggles of building those resiliency practices. So this is one more tool that was shared with you. It's by Charles Figley and Beth Stam. It's very well researched. Please feel free to go on their website and take this. What it's going to measure is your compassion satisfaction, which you'll want that number high, your burnout, that number you'll want low, and then secondary or vicarious trauma, you will want that number low also. When you take it via the web version, the great part about that is you don't have to enter your email. It's not taking your name unless you want to participate in the study. But what it will do is it will automatically score those for you and then give you a printout of what your results are. So you can go to the next page of the document and it will share with you what the results are. I think part of it too, we always recommend people, some of these tools we're giving you, and then we're going to go into resiliency tools next. So if you would take that now and then practice some of these resiliency tools, what works for you, and then take it again in 6 months and see if you're benefiting, if you're showing some results from your good practices. We like to stress with people that it's so important, again, that you can't be compassionate with other people if you are not being compassionate with yourself. So let's think about something that you're doing already for stress management.
think about what you already have in place, and then how can we transform all of the negative things that we might be experiencing or hearing during the day, and transforming it a little bit so that we can get rid of, transform those negative beliefs and loss and cynicism, sarcasm, so that we can be replenished, so we can fill our back up. So for me, an example of this would be I take my dog for a walk every day for 30 minutes out in the neighborhood, walk fast, getting my exercise right. But how can I transform that a little bit? How can I make it a little bit better so that I could really transform all of this compassion fatigue and vicarious trauma? So one thing I could do would be I could look up while I'm walking. I could be mindful in my walking, take some deep breaths. I could appreciate nature. This was actually a picture of something a flower that I took on my walk. But the thing that was most impactful to me was I noticed as I was walking, I would kind of rehash the day, and I would look at everything that was wrong and negative, and I would ruminate about that. And so that was not helpful for me. That was causing me higher anxiety. And what I really had to do was do mindful breathing and mindful walking so that every time a bad thought would pop up into my head, I could just erase that and continue doing some deep breathing and enjoying the time that I had walking.
And again, think about that mind-body connection. If we had more time together, we would discuss a little bit more about that. But the idea that when you increase your cardiac rate and you actually start thinking about breathing some of that stuff out of your body, there's not only psychological and physiological benefits to it, but it increases that resiliency and can be used as a tool.
So we want to give you another tool that you can use at work, and it's called Hot Walk and Talk.
So this tool was something that Kay and I were just trained on about 2 months ago in Canada by our trainer. One of the things that they're recommending that folks use on their work site is this idea that if there is a traumatic event or some type of event that is having a toll on a staff person, one of the things we could do immediately to benefit that staff person is to grab them and go for a walk. I mean, a brisk walk. The idea, too, is we want to have bottles of water because we want to be able to hand that person and encourage them to drink while we're walking. The other component of this, we're going to support this person in telling the story. So we want to encourage them, tell me what happened. How did this start? What happened? Who came in the room? Who was there? What was said? And then encourage them, what happened next? You know, making sure that we have a start, a middle, and then most importantly, an end to that story. So while they're drinking water, physically flushing this out of their system, they're increasing their respiration, and we're helping them develop the whole story, be able to talk about it from beginning to middle to, and most importantly, the end. They recommended that if this was a type of thing that an incident report needed to be done, that as you're finishing your walk and you're making sure you're asking, would you like to go through the story again? Share with me what happened again. So as you're ending and you get to the end, then you can ask that person, we have to fill out a report, like an incident report for this. Would you like me to type it or write it for you? Would you like to write it? How do I support? So again, that idea that we're giving people closure to this event is so important.
And what I like about it is that you're hydrating the person, you're flushing out basically that cortisol, that anxiety, that adrenaline that's happening in your body. So you're walking, you're drinking water, you're talking about it, you're getting it out right as it happens, and then you don't have to take it home with you. You don't have to take it home and ruminate and worry about it and let it fester and then continue to be a problem the next day. It's done. It's over. So these are some other around you that connect the mind and the body. That's just some ideas for some grounding techniques to help put in your toolbox for your resiliency tools.
Kay and I have tried a lot of these, and we continually try to mix them up. So if you have additions to our list, make sure you email us. Some of the ones I want to share with you a little bit about is Reiki, is that ancient Japanese healing art. And so one of our university hospitals actually practices, they call it hands-on healing, which is a little bit different, but it's actually a Reiki practice. The other one would be emotional freedom tapping, that idea that there's some techniques specifically that therapists can learn and teach to you that give you some central kind of like acupuncture, acupressure points to tap while going through some positive affirmations, helping move that vicarious trauma from one place to the other. Drumming circles are great. I teach yoga. I love yoga. I think it's a great tool. Aromatherapy is being used in a lot of our healthcare settings. So all great tools to explore. If you have additional things you'd like to add to our list, please do.
I do. I have an additional thing to add.
Okay.
One thing that I have tried is EMDR, which is emotional desensitization reprocessing, eye movement desensitization reprocessing. And EMDR, you have to go to a trained therapist. It's something you could Google to see what it looks like. It sounds strange, but basically you look at a horizontal light board as you're talking with your therapist, and it's short term. The therapist has to be trained, and you talk about your trauma, and he or she will reprocess that trauma. And the theory is that the trauma goes to a different hemisphere in the brain so that it's less intensive. You're not going to forget about the trauma, but you don't ruminate and have anxiety about it. And it's research-based and works well with trauma and emotional trauma.
I think the great part about EMDR, too, is that idea that it retrains our brain. So after you've gone through EMDR, it allows you to remember what happened, but your brain doesn't immediately start secreting those chemicals to put you into fight, flight, or freeze. So it has huge benefits. And I think as we continue on down this path, we'll find more and more out about how our brains work and how to keep them healthier.
And so you might want to think about this in terms of a commitment. What kinds of tools can you make? Can you pick through that list or what was given you somewhat today? Look at the resource list. And what commitment could you make for daily self-care? What items that we talked about, because it's so important to do this every single day and not wait until things build up and you have to have, hip replacement surgery.
Maybe after our webinar today, you could share some of this information with a coworker and see if you guys can be accountability partners. Maybe we're going to take a walk over lunch, but we're going to take a walk and not talk with trauma-filled information, not ruminate that, but really make that a positive restorative practice. Maybe it's the idea that you're going to have lunch, actually take a lunch break. But we want to share this with you. This is from Charles Figley, Green Cross, Ethical Standards for Health or Self-Care. And I love this, that idea of first do no harm to yourself in the line of duty when helping or treating others. Second, attend to your physical, social, emotional, and spiritual needs as assuring high-quality services for those who look to you for support as a human being. And we're so thankful there's people out there like you all doing this work. We want to help and support you in the work that you do. And so thank you so much for your time. And please feel free to look at Charles Figley's website for more standards regarding how to care for yourself?
Now, we've talked about this now for, 40 minutes, and I want you to think about in your head the top 3 people that you care most about in this world. So I'm assuming you have those names in your head, right? Now, I want you to raise your hand high. I can't see you, but you can raise your hand high if you said yourself. And when we do this training, we maybe have one person out of 50, or we have nobody that will raise their hand. Because, again, we think that self-care is selfish. We want to help everyone else before we can help ourselves. But truly, we cannot help others and be the best that we can be unless we do take care of ourselves.
So again, it's that idea of if you are not compassionate with yourself, you can't be compassionate with other people.
And please refer to our website because we do have additional handouts, we have additional resources available, and we update that pretty often. So very much appreciate the time that we've had with you today.
And we'd love to travel, so if you'd like us to come out, just let us know. Thank you so much.
Wonderful. Thank you, Kay and Beth. So now we'll open the webinar up for questions. And again, if anyone has questions, please type them into the chat box and we'll have them answered. So we have one question to start off with. What are techniques that will work well and can be used in the workplace? So you gave an example of the hot walk. What are additional examples that people can use?
Well, one work setting had at 10 o'clock in the morning and at 3 o'clock in the afternoon, whoever could would walk. We do a mile walk, and we could not talk about work at that time. But it's just a break, because the worst thing we can do is sit all day at a computer for 8 hours. That's the worst thing we can do for our body.
I think another idea, too, is just that idea of, again, setting a timer on your phone. And even if it's just a little ding, a couple times a day, and just taking a moment to practice some gratefulness, because we know that also changes the brain chemistry. There's all this new research about the practice of gratefulness. So just the idea, sometimes my day it gets so rocky that I'm just thankful there's even toilet paper in the bathroom when I go. But anything, to refocus that brain and to rejuvenate yourself.
You can do some chair yoga. At one of the workplaces, they actually had yoga as a part of the wellness group, and they offered that on work time. The book club idea, continuing the conversations, sometimes we know in healthcare you're running all the time, and sometimes it's just a matter of taking the time to do some deep breathing.
Wonderful. We have another question. What are some examples of how people can separate work and home stress?
Good question. We do talk about this a lot. Some people exercise right when they get home. Some people change their clothes. They take their badge off. Some people, working parents, they take 5 minutes, set the timer for 5 minutes, and in the driveway before they get into the house, they do some meditation. Really just not working would be one.
Staying off your phone.
The cell phone, you could work 24/7, so putting boundaries around that, and what are your supervisor's expectations for that if they email you? In France right now, they passed a law where employers cannot contact, email, call employees after 5 p.m. So those are some ideas that other training participants have shared with us.
Wonderful, thank you. And then there was a question about the primary trauma slide. Can you go back and just redefine and kind of separate out what compassion fatigue, vicarious trauma, burnout, and moral distress are, how they're different from each other?
Sure. Let me try to take you back to that slide. Compassion fatigue really results, it's in that ability, or how the symptoms of it are somewhat the same but somewhat different. It's really our loss of being compassionate with ourselves that results in compassion fatigue. Vicarious trauma is, most of us work with pretty, it's an emotional traumatic field. People have suffered emotional losses too. Maybe it's related to their physical pain or the loss. So vicarious trauma really is cumulative over time. So it's not the one bad story, but it's maybe story 100 that just basically you start seeing some loss in your ability to be really empathetic at your work site. It's also how, if you think about it, your worldview has changed if you've been in the field for quite a while. So we start into our new jobs, it's all rainbows and kittens and we're happy, and then 10, 20 years later, we often are jaded. We view the world as negative, we don't trust, and so it really impacts how we view our world. And there are ways you can switch that around, but it really does impact that. And vicarious trauma, there's really no way to take that away. For me, I have a large amount of vicarious trauma just because I've interviewed hundreds, probably thousands of children and adults regarding, physical abuse, sexual abuse, and neglect. I can't wave the magic wand and make that go away, and it has changed my worldview, but I'm aware of that now, and I know at different times in my life I've had to reach out for EMDR or different support groups to help kind of, balance that out a little bit. Then burnout is truly that idea that it's work related and it's only at work. So maybe if I changed, not necessarily careers, but worked for a different provider, I might feel better about work. Does that help answer that question?
Yeah, thank you. So we don't have any more questions at the moment, so I think we'll just proceed on. And if any questions do come up, please feel free to reach out to Kay and Beth via their email, and they will be happy to answer those questions for you. And their email is on the screen now. It's info@compassionresiliency.com. Wonderful. Thank you again. So
Thank you for hosting.
Absolutely. So just before we wrap up, I want to remind everyone that the last webinar in the CHAMP CCHN Distance Learning Series is coming up on September 21st. And this webinar is called Preparing for Outreach and Enrollment Period 5, Addressing Changes in the Marketplace. And it will be hosted at 11 a.m. Mountain Time or 12 p.m. Central Time. And the webinar will focus on how outreach and enrollment staff can maximize their services for the upcoming outreach and enrollment period. And we will be joined by Elizabeth Hagan and Heather Bates from Families USA. And registration is now available for that, and I will include a link in a follow-up email with the webinar recording and resources for you. And just as a reminder, today's webinar will be archived on the CHAMP's YouTube channel. A link will be sent to you in the follow-up email that I just mentioned. To learn more about upcoming webinars and other events and archived CCHN and CHAMP's events, please visit cchn.org and under About Us, click on a link to Events and Trainings, or you can visit champsonline.org and click on Events and Trainings. As always, your feedback is extremely important to us, and there will be a web survey that pops up when we end this event. It'll take no more than 5 minutes to fill out, and it helps us to tailor our future training. So we do appreciate you taking the time to fill that out as well. And I'd like to thank Kay and Beth for sharing their expertise with us today, as well as my colleague Liz Tansey from CCHN for her continued collaboration with CHAMPS on these webinar series. I'd especially like to thank each of you for joining today's call and for your commitment to the community health mission and your passion to strengthen the network of community health centers in Region 8. And I have a quote here from Kevin Heath. It says, "No act of kindness is too small. The gift of kindness may start as a small ripple that over time can turn into a tidal wave affecting the lives of many." All right, thank you again, everyone, and we hope to see you on the next webinar.
Thank you.